Alright guys, welcome back. So our second video is about depression. And what I have listed here are some general symptoms, warning signs if you will, of depression. And really what I want to get across with this video is that I'm really speaking to the people that aren't necessarily meeting full criteria for depression, but those of you that may be experiencing 2 to 3 symptoms that may be impeding your functioning. So things like feeling more sadness than usual, finding yourself crying very easily, getting irritated at things that normally you would overlook, losing interest in things that you usually like to do, having issues falling asleep or staying asleep or even sleeping way too much, being tired all the time, changes in your appetite, cognitive issues like slow thinking or trouble concentrating or making decisions, feeling guilty or worthless over things that normally people wouldn't be feeling guilty or worthless over. And then obviously the most severe symptoms would be things like thoughts of death or even attempts of suicide. So some helpful tips for depression, and these might seem pretty straightforward, but sometimes when we're in the midst of feeling these symptoms, we forget to do some of these things. So the first one here is just stop ruminating. And ruminating is just basically getting stuck on what you're thinking about. Reflection actually is a really good thing. It helps us to understand ourselves and know what to do next. But ruminating is this issue of getting obsessively thinking about what is making us depressed. And that really kind of hinders us from making movement in the right direction. The second one here is stick to a routine. So people who are depressed tend to have issues with appetite and sleep, like we discussed. And so sticking to a routine to even when you eat meals, when you wake up, when you go to sleep, exercise, all of those things are really important. Reaching out to others, basically just asking for help. And this is a really hard thing to do, especially when you're feeling down. You don't want to bother anybody with asking for help, but this is a really critical tip for feeling better, because sometimes just asking a friend to go out and have a coffee or a drink with you is really helpful. Choose SMART goals. So these SMART here stands for specific, measurable, attainable, rewarding, and time limited. So things like getting a load of laundry done, or picking up your clothes from the dry cleaners, or getting to work on time. These are very specific, measurable, attainable goals that are time limited. You don't want to be picking something that's going to take a couple of weeks to get to. You got to be focused in the here and now. The last thing here is to write down all of the things that you used to love doing before you started to feel this way, and to begin to reincorporate those activities into your life. So things like reading a book, or spending time with family or friends, or doing an outdoors activity that maybe you stopped doing because you were feeling down or tired. This next is a free download, and we'll link it in the Facebook link below. But this is 10 easy coping techniques. And so we kind of have already covered some of these in our stress, but overall these are really great for depression as well. So you can see here, I'm not going to read all of them, but taking deep breaths, using positive self-talk, visualizing your favorite place, scheduling time for yourself, thinking of something happy, and practicing yoga. And all these are really great, easy coping techniques that you can do when you might be experiencing 2 to 3 symptoms of depression.
Okay, so what is going on in your brain when you have things like our symptoms of depression? Well, a lot of it has to do with chemical imbalances. So what you're looking at right there, that's a synapse, and that is basically the gap in between the end of a neuron and your brain. And that synapse right through there is going to help pass what are called neurotransmitters, and those are things like dopamine, norepinephrine, and serotonin. So basically, if these chemical imbalances, if these neurotransmitters aren't working like they're supposed to, it's going to create an imbalance in your system, and from there, if your brain's not receiving or reabsorbing these things properly, it can cause symptoms like depression or anxiety, some of the things we're going to talk about. So my question is, though, what controls these things? Well, it's your central nervous system. And if your central nervous system's not happy, or if there's problems within your central nervous system, these chemicals aren't going to be distributed like they're supposed to. So chiropractically, what we tend to do and what we're looking for are these things called subluxations. Subluxations are misalignments in your spine that start compressing on nerves coming off your spinal cord or directly on your spinal cord. The picture that you're looking at there, obviously the healthy side there, you can see that the brainstem doesn't have any impingement on it whatsoever, so the brain can receive signals like it's supposed to, and it can also give your body signals like it's supposed to. The sickness side of that, that's your subluxation. That yellow bone right there is called your atlas. Your atlas is basically the top bone in your spine. It's the most important area as a chiropractor that we want to make sure is free of subluxation. But when it's subluxated right there, you can see it directly impinges on the brainstem. When the brainstem is impinged, it's going to cause a lot of problems within your central nervous system. Brain's not going to be able to receive signals, and it's not going to be able to give your body signals like it's supposed to. So that is very important that you get your atlas checked, and if it's subluxated, get it corrected, because it can create huge imbalances in your central nervous system and cause things like depression, anxiety, and ADHD as well. All right, so the next video is going to be on anxiety. We're going to take another break here, let you guys go back over the slides. We're also going to be asking questions and giving away prizes for the correct answers to those questions. And we'll start your anxiety video here in just a sec.